Hi, folks. Thank you for tuning in. My name is Alina Marchant. I'm a licensed health insurance agent, and today I'm going to be going over the Health Saver Gold Edition. Chances are, if you're watching this video, it means I have already sent you a quote, and I am just making this little video to just explain briefly the definitions of how to read the brochure. All right, so the way I designed this plan, usually the sweet spot for a lot of folks is the $250,000 calendar year maximum benefit. But the lifetime of the policy is $5 million. Okay. The deductibles are usually at $7,500 to $5,000. Those seem to be the sweet spot. And then usually I like to have folks with the gold preferred 3-unit, which is the last column here in the brochure. The Gold Plus 2-unit is also a really good product. It's more designed if you want to stay more in network. However, it does work just about the same. The Value 1-unit plan, not something that I particularly like to advertise, as I don't believe it's enough financial protection for you. However, we do group these plans with maybe a group plan that you have with your employer or an Obamacare plan, giving you extra added benefits and protection. The 1-unit plan is definitely the way to go. I want to point out this deductible. Now, we are legally liable to pay claims, and the commissioner tells us what deductibles we can have and what we can't have. So at a $7,500 calendar year deductible, I want to point out that we actually give you $3,000 towards that first inpatient stay. Okay, so that kind of brings your deductible actually to $4,500. It's kind of a play on numbers. And also, it's not saying that if you go into the hospital, now you have to pay $4,500 right away before we'll pay any benefits. It is not like your traditional ACA plan. That is not how we work. We actually take that deductible away from the benefits that we give you, that you accumulate every day that you're in the hospital. Okay, so it's not a you pay, then we pay. Nope, not at all. The hospital doctor's office sends us the claim, we pay with whatever benefits you have accumulated, and we go from there. I will tell you the deductible is only if you're confined to a hospital, meaning you have been checked in, admitted to a hospital. It's the only time the deductible applies. For the 3-unit, if you're going for a covered sickness, it's $4,500 per day. If you're in the hospital for a week, a lot of the times that's only, you're only there for observation, or you're there for just room and board. You'll be surprised at how much that actually costs. It's about $400 to $600 a day. All they're doing is feeding you. Doctor comes in, has an 8-minute chat with you, maybe once or twice a day. So you can see how those benefits start to accumulate and rack up. ICU, we give you even more money. Anything relating to outpatient ambulatory surgical stuff, we give you even more money. Outpatient radiation, this is your chemotherapy, your cancer. We only pay $22.50 per day of treatment. Again, staying in the multi-plan network, that's where you're going to get those pre-negotiated prices. So it's really, really important to stay in that network. What breaks us away from being major medical? We do not cover maternity. We do not cover drug and alcohol abuse or mental health. So if you're the kind of folk that needs to see a psychiatrist or a mental health profession or go to drug and alcohol counseling, I'm going to tell you right up, this isn't the plan for you. You need to be in an Obamacare plan. Professional services, this is what gets a lot of folks. The preferred 3-unit plan, I notice here it says 3X RBRVS. What that basically means is if a person with Medicaid or Medicare goes into the hospital for the same procedure as you, the government says we're going to pay a fixed amount. That's it. That's all you can bill, nothing more, and you can't go after the patient for the rest. Well, our doctors love seeing that PHCS network on our card because we pay 300 times, 300% over what that same surgery procedure would be for a patient with Medicaid or Medicare. Okay, so that's what that means. Now, additional outpatient benefits, these are where folks use this plan the most. 20 doctor's visits a year, 6 chiropractic visits a year with 2 specialists. Okay, we pay $160 per day. The way this works, if you go into your doctor's office, let's say your doctor's cash price is $120, you have $40 left of benefits left over. We don't keep that. We refund it back to you. It works the same way. If your doctor's office charges $180 for the visit, we pay $160. They fill out the claim. We pay the $160. You pay the remaining $20 directly to them. Okay, MRIs, CAT scans, you go to the doctor, your physician charges $120. He wants to send you in for an MRI. We're going to pay $700 towards that MRI. Again, staying in network. MRIs are actually not that expensive. You can call me as your agent. I will price shop that for you, or you can call our healthcare pals. They can find facilities right in your zip code that give you the best prices for what you need. But again, we'll go over that a little bit more on the phone when we talk. Emergency room, you get the $400 for the visit. They need x-rays. You get another $240 on top of that $400. That's all without paying a deductible, not like your ACA plan. Ambulance, ground, air, $1,000 for an ambulance ride, $2,500 for a helicopter ride. A lot of the times I group these plans with our accident plan that gives you even more benefits, like $5,000 or $10,000. So you can see how having that big bucket of money really saves you in the end. The prescription, $30 for generics, $60 for brand name. You have access to a script saver card, which is kind of like the GoodRx card you see on TV. I had somebody the other week there, and she had been paying $15 a month as a copay for her blood pressure medication. She used a ScriptRx card, $4. $4 was actually the price for her medication. So, you can see how this works. Your benefits are available to you after 60 days. In some states, it's 30 days. So depending on what state you're in, that does vary, but I go over that with you on the phone. Optional critical illness rider, $10,000 to $50,000. What this means, you have a stroke, you have a heart attack, you have internal cancer. Depending on where we have your critical illness benefit set, we send you a check for the lump sum. You can use it to pay whatever bills you need to pay. You can put cash in your bank account. Doesn't matter. We don't ask you how you're going to spend it. We just give it to you. Great for small businesses, great for entrepreneurs, great for people who might have a heart attack or be at risk, maybe family history of it. I don't know, but we give you that lump sum of cash. This kind of explains a little bit of how the deductible works. We already went over that. Another great product we have is the Teledoc, 24/7, 365. Call them up, get a doctor right on the phone. Doctor sends your script over to whatever pharmacy you want. You go and pick it up. You never have to go into the doctor's office. This is something a lot of people are starting to really take serious with, the COVID and everything. And who wants to spend time waiting in a doctor's office? PHCS network, multi-plan network. I send it to you in an email so you can look up your doctor. Again, you don't have to stay in the network, but you save a lot of money if you do. Freedom to choose anywhere in the United States, anywhere you want to go, plan's still going to pay. Script save card, we already discussed that. This is the number to our healthcare pals. That is Surgery Saver, Bill Negotiator, really, really, really great service. So this is just a quick informative video of how to read the plan brochure. Definitely feel free to give me a call, send me your message, sending me a message with your questions in an email. There's several ways of getting a hold of me. I just wanted to make this video so you could watch this on your own time. And I look forward to speaking with you soon. Thanks a lot. Bye.